Hi, I'm Terry Kim, Professor of Ophthalmology and Division Chief for Cornea here at Duke University Eye Center. So our cornea division, I think of as one of the tops in the country. We are comprised of 10 faculty now, who I think are leaders in their fields. And I think what really sets apart our cornea division are our faculty and our staff. We also pride ourselves on our fellowship program, which actually dates back to 1979. So we have an over 40-year history of training cornea fellows. I always tell our applicants there is no perfect fellowship program out there, but I think ours comes pretty close. I think one of the major strengths of our cornea fellowship program is the amount of pathology that we see in cornea. Anyone knows who's going into the field of cornea that the field itself has exploded. And I think we are equipped here to really handle these patients and also to train our fellows right by our side. So we're really capable of managing all these corneal problems that we see here because we not only have the faculty and staff to do so and the talent to do so, but we also have the technology to do so as well. And this is a huge advantage for our fellows and our fellowship training program because anyone knows in cornea, it's very technology driven. And this is essentially what we've decided to focus on with our fellowship program. We take 3 one-year clinical fellows, and really the emphasis of that fellowship year is clinical training. Our goal is really to expose our fellows to this pathology and have them become the best cornea and refractive specialists when they come out of their training, so they feel comfortable in handling these issues when they go out either to their private or academic practice. We have a really strong culture of collaboration here within our cornea division. Many of us work on projects and papers together, and we always involve our cornea fellows and our cornea residents. We want our fellows to really become part of our family, and that's what happens. So the relationship continues even after the fellowship training. If you had to ask me what we're looking for in our fellowships, well, I think you can just look back at the fellows we've trained over the last 40 years, and many of them have gone on to prominent positions within their practices and their academic institutions. But I think the one thing that they have in common is they really know how to take care of patients, not only from the standpoint of their medical and surgical management, but also how to be compassionate and kind doctors. And we want someone that's also going to be able to collaborate, not only with our faculty, not only with their co-fellows and certainly our residents, but also with our patients and our staff. And that's a really important component of our training program. Not only do our fellows participate, obviously, in the clinical care of our patients, but we also have a lot of educational opportunities for our fellows. We certainly have our departmental grand rounds, but we also have our division cornea conferences. We also have specialty cornea conferences dedicated to our fellows, where it's just our faculty and our fellows discussing cases as well as any other areas of interest that they have. We also hold our annual cornea conference that attracts a lot of our referring physicians, and it's a great opportunity for our fellows not only to present at this conference, but also interact with our guest faculty. You know, I couldn't be prouder of our cornea faculty. I think we have really one of the top faculty in our country, which is, I think, one of the reasons why our eye center is consistently ranked as top 10 in the country. I want to start with our Cornea Fellowship Director, Melissa Dalavoy. She's really the foundation of our Cornea Fellowship training program, and she really makes sure that all the needs and wants of our fellows are met during their year of fellowship training. She really goes out of her way to build that schedule and to make sure all the educational opportunities are there for them. Here at our main institution at Hudson, we also have supporting clinical faculty for our fellowship training. That includes Victor Perez, who has just established the Foster Center of Ocular Immunology, and they're going to be exposed to a whole host of ocular surface diseases and procedures for these patients. They'll also get exposed to Lloyd Williams, who has a specific interest in global health and international ophthalmology. Anthony Kuo is one of our faculty who's really a noted national and international expert in ocular imaging, and the work that he does is constantly being integrated clinically, and the fellows have a great opportunity to also get involved with research and projects with him. Alan Carlson is one of our senior faculty who's moved more into the medical cornea role, and he has a particular interest in infectious keratitis and helps guide our fellows with the diagnosis and management of these patients. We also have Priya Gupta, who's the medical director of our Page Road Clinic, and Christopher Belke, who's the medical director of our Raleigh Satellite Clinic. They also bring a unique perspective to cornea practice through their own individual practices and also through their individual interests. And we also have Drs. Terry Simpkinson and Angela Vacade at our Winston-Salem Satellite. And they are always active in our annual conference and our various educational training programs that we have for our fellows throughout the year. So I really welcome anyone who's interested in cornea to come look at our fellowship program and our department and our division closer. I think we really offer an amazing experience for our trainees at every level, but certainly for our cornea fellows in particular. I'm very proud of the division that we have here and our faculty and our staff here. I'm also very proud of all the fellows that we've trained, and I encourage you to contact them to get more information. But I hope this gives you a sense of what we have to offer here at Duke, and we certainly hope that you can become part of that experience and part of our family.